If you've been dealing with lower back pain, pelvic pain, or hip pain, you might already know how frustrating it can be. Maybe you've tried stretching before, but the pain keeps coming back. It might be because these areas work together and treating just one often doesn't fix the problem. So in this video, I'll walk you through a few simple but powerful tools that you can use to help rebalance and integrate your lower back, pelvis, and hips. By the end, you'll have a go-to set of stretches and exercises that can actually make a difference. Hi, I'm Alexis Wadeland, osteopath and co-founder of Blossoming Me and Healthy Learning Lounge. So let's get started. First up, we want to loosen some tight muscles with some targeted stretches. So stretching for the lower back. If your pain is coming from tight muscles or stiffness, these can really be beneficial. First, there is the cat-cow stretch. Okay. So with the cat-cow stretch, we're going
gently into curving your back. We're tucking our bottom under and relaxing our neck and pulling our head downwards.
and then we're arching our back, trying to get an even arch all the way through our back. So we're often having to focus more on pushing our rib cage sort of forwards and down, not so much our lower back. This stretch is great for mobilizing and reducing stiffness. So as I just showed, we get on our hands and knees. Our shoulders need to be above our hands and our knees under our hips. We inhale and arch our back, and we lift our head and tailbone, pushing our rib cage downwards. Then as we exhale, we round our back, tucking our chin and bottom. Repeat this slowly for around about 10 times. The next stretch is a child's pose. This is great for reducing the compression in our lower spine. So for this one, we want to sit back on our heels and let our arms extend forward, resting our forehead onto the floor or as close to the floor as we can. And we want to hold this stretch for around about 30 to 60 seconds. Sitting back on our knees. If you feel extra stiffness in one side of your lower back, it can be helpful to shift slightly to that side to stretch a little bit deeper. Essentially, you're just doing a little bit of this. If your back feels really stiff in the morning, or if you get intense stiffness or pain, it's really useful to start very gently. So this next one is just a gentle pelvic rocking. So you're lying on your back, you bring your knees up so that your feet are flat on your bed, and you're just gently rocking your pelvis forwards and backwards so that you're flattening your back into the bed and then gently arching your back away from the bed. Just like this. So next we'll work on your pelvis, especially if you have sacroiliac joint pain, imbalance, or instability. So this is a good one to stretch out your glutes, which can actually be beneficial to help your hips, your sacroiliac joint, and your lower back. This figure 4 stretch is where we can sit on a chair and cross one ankle over at the opposite knee, and then we're gently pressing the knee down, keeping our back nice and straight, and we hold that stretch for about 10 seconds. We can repeat that multiple times and do that obviously to both sides. You can also perform this one lying on your back. So you're bringing the foot over the knee, and then you're bringing that leg upwards to increase the stretch here, and then you can stretch the knee further backwards. When you're performing the pelvic rocking, as you rotate your pelvis towards your head and you're flattening your lower back into the bed, notice that you're also activating your pelvic floor and your lower transab muscles. These muscles are hugely important for the stability of your pelvis and to support your back. So this is a great start to reactivating your pelvic floor and transab muscles for your core stabilizing muscles, so that you can then build on that to help strengthen your back, allowing for comfortable mobility so that your back functions in a safe, stable way. As you feel like this pelvic rocking movement is getting more comfortable and more easy, and you're feeling the activation of your pelvic floor and transab muscles, then you can extend that exercise so that you're slightly bringing your bottom up off the bed. This is a stronger activation of those pelvic floor muscles and transab muscles, as well as your glutes and your hamstrings. This helps to support your whole pelvis, helps to activate the hips, and helps the lower back to be able to relax as the correct muscles start to engage. So just you lift your bottom up, hold for 2 to 3 seconds, and then you slowly and gently drop your bottom back down to the bed. So you can start by literally just lifting it off the bed, but you can also lift your bottom up as high as you possibly can. That would be a further extension though. Stretch is more for the hips. So tight hips will pull into your pelvis and into your lower back, causing an imbalance and pain. Stretching our hip flexors. So for this one, you're doing a knee up, and you're going into a bit of a lunge. So first of all, you want to tuck your pelvis under. Then you're going to bring your body as far forward as you can so you can feel that stretch in the front here. You're wanting to make sure your knee is over your ankle, so move your foot further forward if you can go further. Once you're in this position, then you're going to turn to the upward knee. And that increases the stretch, and you should be able to start to feel it almost into your lower abdomen. For that one, you want to hold into it for 5 or 10 seconds. Repeat a few times to each side. With that one, you want to remember to keep your back straight. So the next one is pigeon pose, and this one is a great stretch for your glutes and your hips, and also it can work into the sciatic nerve, so be careful because it can cause pain, and if so, you just want to back off. So it's okay to feel the discomfort, but not true pain. So for this one, you're bringing one foot forward and then you're just coming slowly on. So you're relaxing your buttocks onto your foot as much as you can, and you've got your weight on your hands, and you're just relaxing into that as much as you can. So that's affecting this left side. So you can stay up higher if you need to, otherwise you're dropping down. Again, it's good to hold for 5 to 10 seconds and repeat a couple of times to each side. So starting to build strength then, we want to start with the bridge, which was going back to the pelvic rocking. First the pelvic rock, and then you're lifting the bottom up and holding and gently rolling back down. And you repeat, you're holding up there for 3 seconds, and you repeat 5 to 10 times. So for the next one, we want to be lying on our side for the clamshell. So for this one, we're just trying to increase external rotation of our hip. So we're just literally opening the hip up, using the knee and keeping the feet touching. And repeat this probably about 10 times. So this helps to strengthen the glutes and gets movement into the hips, helping to support pelvic stability. So by bringing that all together, you've got about a 5-minute exercise and stretching plan to help you in a daily routine to help reduce pain, improve balance, and integrate those areas. Then you can strengthen by building into the bridge and by doing the clams. Try doing this routine for just 1 week and see how your pain improves. And if you have any questions, make sure you let us know. So which of these exercises feels best for you? Let me know that in the comments. I hope you found this helpful. And please remember to hit like and subscribe for more of our pain relief strategies.